This is part two of the sore throat series. In this series, we will further explore the difference between viruses, strep throat, mono, and some other possibilities that may cause your sore throat. Our team will show you how to save significant potential dollars on lab testing based on having a little knowledge about the possible causes of sore throat. Let's get started. We'll also have an expanded discussion about the specific tests, and we'll highlight an example of two different patients and their different outcomes as far as costs. With this knowledge, these tips, these quick, simple things that we'll show you will help you to make decisions in conjunction with your doctor that could potentially save you a significant amount of money. As you recall from part one, the center criteria are a group of 4 symptoms that help physicians decide whether a patient may have sore throat. As you recall, fever, sore throat with swollen glands and white stuff on the tonsils, swollen glands under the chin, and absence of cough comprise those 4 things. Mono is a virus causing very similar symptoms, although the illness of mono can be quite prolonged. Mono has some unique complications which may make it important to know, particularly if you're young or an athlete. Mono at times can cause the liver or spleen to swell, and in that setting, most physicians would advise that particular patient to avoid contact sports or contact activities, or essentially any activities that could cause injury to the abdomen to be avoided. The reason for this is to prevent rupture or breakage of the spleen or liver, which could be life-threatening. There are a variety of other possibilities that can cause sore throat. You need to hash through these with your doctor. Acid reflux, smoking, postnasal drip, allergies, dry winter environment. Those are just a host of a few possibilities that you can discuss further with your doctor. Strep and viruses, probably the 2 most common causes of a sore throat. The center criteria can help us predict who may or may not have strep. Mono, usually self-limited, very similar symptoms at the start of things, but again, there are some other issues and other complications. Depending on the age of a patient, that may have some bearing on whether testing is indicated. The majority of older adults have already had mono at some point during their childhood. If you've already had mono, there's really not much point in retesting for it if you've already had a confirmed case of it by a lab test. So, who needs a rapid strep test? Should you have a strep culture or strep PCR, which is a more involved chemical test after if the rapid strep is negative? How about a CBC or a CBC with differential? CBC is just short for a complete blood count. That gives the doctor a breakdown of all your cell types: white blood cells, red blood cells, platelets, which are the sticky things in your blood, and then the differential will further break down the white blood cells. It may have some predictive value in trying to figure out if the illness is caused by a virus or a bacteria, but for the vast majority of patients, our team feels it's probably not necessary. So let's go through 2 examples. Patient 1, Dr. X, comes in with symptoms of fever, 101, sore throat with swollen tonsils, not coughing, and complains that the glands are swollen under the chin. After the exam, the doctor determines, based on the center criteria, which have been validated and cited in numerous medical sources, that there's over a 50% chance of having strep, decides that no lab tests are indicated. Patient 2 with a different doctor, Dr. Y, comes in with identical symptoms, also greater than 50% chance of having strep, decides that we should have a CBC, complete blood count, and a rapid strep test. So for patient 1, he gets a prescription for penicillin. There's no lab costs. He's out the door without any extra costs. Prescription cost for penicillin is $4 or less at the majority of major pharmacies. Patient 2 is there for quite a bit longer in the clinic. He gets a rapid test, which is positive. He also gets a CBC, also gets a prescription for Augmentin. So the cost of just the rapid test and the Augmentin is $150.32. If you add on the cost of the CBC with the differential, that's another $50+. So you're talking an extra $200, which could be out of pocket depending on whether you have insurance or not, or your particular health plan, or your health deductible.